What is Botox? What does it mean? What does it do? Is it appropriate for me? I'm going to answer all of your questions today. Hi everyone, I'm Dr. Weinstein. I'm a board certified dermatologist. I've been practicing for about 10 years now. I also did a fellowship after residency training, specifically in lasers and cosmetics. So I truly am an expert in aesthetic cosmetic dermatology, and I'm here to answer all of your questions. One question I get a lot is, what is Botox? What does it do? Is it safe? Is it right for me? So I'm going to break that down for you today. So hopefully after this video, you have a better understanding of what your options are, what might be appropriate for you, and whether or not you're ready to take the plunge. Botox is actually a brand of botulinum toxin A. Botulinum toxin is derived from a bacteria called Clostridium botulinum. There are actually a few different toxins produced by that strain of Clostridium, but botulinum toxin A is the one that's most studied and used in the aesthetic world for what's commonly known as Botox treatments. The other name for Botox is a neuromodulator. So by definition, neuromodulators prevent the nerve from communicating with the muscle, which just means that if you are going to make an expression like raising your brows, for example, your nerve is not going to be able to tell your muscles to raise your brow. So instead, it might be a little subdued, a softer expression, or completely frozen. Another place where Botox is commonly used is in the glabellar area, which is your frown muscle. So again, Botox or neuromodulators are meant to prevent the nerve from communicating with the muscle and thereby minimizing the force with which you make an expression. Now that might sound kind of confusing, and you might be thinking, why do I want to prevent that expression? Well, I'll tell you in just a sec. But before we get into that, it's worthwhile to break down the different types of neuromodulators on the market. So currently there are 5 different brands of neuromodulators on the market. There's Botox, Dysport, Jeuveau, Xeomin, and Daxxify. So these are all brand names that you might have heard. And of course, I don't expect anyone to know which one is right for them. And often that's really not a question you should be asking yourself. That's a question for the expert that you're going to see. And which they choose to use will depend on a number of different factors. So what's the big difference between these different brands? Just for the ease of explanation, I'm going to group Botox, Dysport, and Jeuveau into one category. And this is the category where the molecule of botulinum toxin has what we call a complexing protein on top of it. And so this complexing protein, when injected, disassociates from the active molecule so that the molecule can do its job, which is work at the neuromuscular junction to help block the signal of your nerve communicating with your muscle. So these 3 brands all have a complexing protein on them, like I mentioned. Now, there's a theory that when this complexing protein is injected and disassociates from the active molecule, that your body could recognize this protein as a foreign object and develop antibodies to it, which means over time the injections with Botox, Dysport, or Jeuveau might become less and less effective because your body is developing antibodies and now recognizing this product as being foreign. In contrast, Xeomin is what they call a naked molecule. So it is just the molecule, there is no complexing protein. When injected, it's the molecule itself, and the likelihood of you developing antibodies to Xeomin is much, much less. Now, Daxxify is a different beast. It does have a complexing protein, but it's meant to last much longer by the way it was formulated. In the clinical studies, it showed it lasted about 5 to 6 months, where the other products only last about 3 to 4 months. So Daxxify has become a game changer in some practices because their patients need to only come in about twice a year, which is amazing. You might wonder, well, what if I go to my dermatologist and they suggest Botox, the brand, and I don't want to run the risk of developing antibodies? Well, it's not quite that simple. So if you go to a dermatologist who preferentially uses Botox, that's totally fine. They've had years of experience with using Botox, the brand, and they know how to achieve the natural aesthetic that you are looking for, or the desired aesthetic you are looking for. So what's more important is that you go to a licensed professional who gets their product from a reliable source. Now, lately, the media has been blowing up about incidences of people going to see unlicensed professionals who obtained fake vials of Botox. Now, you might wonder, why would somebody do that? Why would somebody in their right mind do that? And the other piece of it is, why would somebody go to an unlicensed professional? Well, the reality is, Botox is not cheap, and perhaps this unlicensed professional wanted to get their hands on some product to make a few extra bucks. And so they got a deal. It was fake Botox. Maybe they didn't know. And maybe they were touting themselves as, license this or license that, but they really weren't. And I don't blame the people who went to see them, because it's really hard to know what people's credentials are unless you ask and you do your research. So in a way, you really do need to do your research to make sure that they've had adequate training. A lot of these products have websites where you can go and check to see who is a licensed provider for that product, for Botox, for Dysport, for example. And so that's a good way to find out if who you're going to is actually a licensed professional. So what was scary about these cases is I told you from the beginning that botulinum toxin A is a toxin derived from a bacteria. There's a disease that it can actually cause called botulism. Botulism is when your body is exposed to toxic levels of botulinum toxin and you become short of breath, and you might experience shortness of breath, dry eyes, dry mouth, and other life-threatening concerns that might cause you to become hospitalized. And in the case of this fake Botox, some patients were hospitalized, and this happened all across the country from New York to LA. So if you learned anything from this video, it's to make sure that you get your product, your neuromodulator, your Botox, Dysport, Jeuveau, Xeomin from a licensed provider. Licensed providers could be board-certified dermatologists like myself, board-certified plastic surgeons, board-certified ENT docs. Just make sure you go to a practice that doesn't look sketchy. Please don't go to a Botox party in somebody's garage. That's not the best way to get your first Botox treatment. Okay, so moving on, what are the areas that we can inject neuromodulators? The most common areas are the forehead, glabella, and crow's feet. The other areas that you might not have known about that neuromodulators can be super helpful with are the platismal bands, which are the bands that come when you strain your neck, the mentalis, which is a muscle that leads to puckering of the chin, the DAOs, which are these muscles that pull down at the corners of the mouth, your nasalis muscle, which contribute to bunny lines. So if you scrunch up your nose, you can develop bunny lines. And we can also inject right at the nasal ala area to prevent the appearance of a gummy smile, which can be bothersome in a lot of patients. Now, another place that can be injected are the masseter muscles. So these muscles can get big and bulky if you suffer from bruxism or teeth grinding or TMJ. Often this is a medical concern, and patients will go see their oral surgeon or dentist and get a mouth guard to use to prevent that grinding. But that doesn't mean that this muscle still doesn't become bulky. So we can inject right into the masseter muscle to help with the pain from teeth grinding, but also help slim the face, because a strong jawline in a woman, mainly because of the masseter muscle protrusion, can actually look very masculine. And we can talk about how to masculinize or feminize a jawline. Let me know. I can definitely do a video of that, so let me know in the comments below. But for this video, we're just talking about areas in which we can inject neuromodulators. Now, neuromodulators are very low risk in terms of developing a hypersensitivity to them. There are very few side effects. It's a very safe treatment when injected properly. It typically lasts, as I mentioned, about 3 to 4 months. Now, it's important to note that it doesn't kick in for about 2 weeks after, so 10 to 14 days. So if you come in for your first time injection, you're not going to see the end result for about 10 to 14 days. And if it's your first time too, that injector should offer you a follow-up visit in about 2 weeks so they can check and see how everything's settled in. I like to call it creating a recipe for my patients' neuromodulator injections. The first few times they come in, we have a map and we indicate exactly where we have placed those injections. And then if they come in for that 2-week touch-up, we can modify the map so that at the end of the day, we have their recipe, and it'll save them a lot of time in the long run because we'll know exactly where they like to have their treatments placed. Another side effect that can be pretty common, especially if it's your first time getting injections, are headaches. So headaches can occur, and it's mainly because you're retraining your muscle, and so sometimes they can come from that tension, especially in the forehead or in this frowning area. And those typically resolve in a few weeks and can be treated easily with Tylenol or ibuprofen. When I inject specifically, there is a little bleb on the skin that lasts a few minutes after injection. Most of these products come in a little vial they're lyophilized, they're powder form, and they have to be reconstituted with saline. Most of what we're injecting is the saline, and that's why you see the little bleb, and those go down within 10 minutes. A lot of my patients will just put on makeup right after or cover up, but you should be able to come in for your injection and go straight to work after. A few no-nos to plan for after your injection. So we don't want you lying down flat or doing anything that massages or moves the muscle around in the areas we place the treatment. This is most important immediately post-treatment. So we say about 4 hours, but give or take, we just want you to be careful with manipulating the area where the treatment was placed because we don't want it to migrate or move somewhere it shouldn't be. It's placed strategically in the belly of that muscle where we're trying to soften the movement. Something a lot of people don't think about is wearing a hat. So if you come in and you put on your baseball cap right after, there's pressure that's directly on the areas of injections, not recommended. If you have a yoga or Pilates class planned right after injections, I would cancel that, maybe pivot to a brisk walk or run a few hours post, or do your workout before. And if you have a massage or something that requires you to lay where your head is flat in a pillow, I would recommend rescheduling, especially if it's your first treatment. We really don't want that product to migrate. Lastly, and probably the most important reason why people opt for treatment with neuromodulators is naturally over time, we lose collagen in our skin and we lose that elasticity and that ability to recoil or bounce back. And so with repeated expressions, especially those that give off a negative emotion, like frowning or squinting or frowning with your mouth, as I demoed earlier, repeated expressions can cause etched lines into the skin. And you all know what I'm talking about. You've seen those 11s on your mom or an aunt or a friend. And even though they're not angry, people might ask, why do you always look angry? And I can't tell you how many times people have come in and said, I'm sick of everybody asking me why I'm frowning or why I'm angry. Can you please just get rid of these lines? And honestly, by that point, it's not too late, but it's difficult to completely get rid of them. So as a dermatologist, I'm all about prevention. So my recommendation is start with little bits early on before you develop etched lines in the skin. And over time, you might not need as much. You also will get used to the feeling of not frowning. And so we see that patients sort of train their muscle not to make that negative expression. And again, over time, you'll need less and less, and you'll walk away without etched lines in the skin. Now, you might wonder about filler or trying to fill these lines. Again, this area called the glabellar area has the highest risk of complications when filler is placed there. And that complication is blindness. So I highly recommend against waiting and just thinking you could get filler in that area down the road. Prevention is key. And I think if you're going to start anywhere, neuromodulators are an excellent place to start. If you hate it, it'll wear off in 3 to 4 months and you never have to do it again. But if you love it, you'll become best friends with your dermatologist, and that's a beautiful thing because you'll have regular appointments to not only get your neuromodulators done, but also to discuss skincare, the latest technology, and what other treatments you could be doing to help prevent your skin from looking dull, from developing brown spots, and just feeling and looking like your best self. Healthy skin is what we're all about. These treatments don't have to make you look fake. They don't have to make you look different. It's just the best version of yourself. Thank you so much for watching. Thank you for sticking with me through this. If you found it helpful, please make sure you like and subscribe below and send to your friends. Spread the word. Let me know what else you'd like to learn.